Rheumatoid arthritis. Rheumatoid arthritis, or RA, is a chronic systemic autoimmune disorder. And RA is characterized by inflammation and damage to the synovial joints. In RA, autoantibodies, known as rheumatoid factors, form in the synovial joint cavities. This immune and inflammatory response causes tissue damage and pain. In RA, the joint space is eventually replaced with granulation tissue. This progressive fibrosis of the joint membrane causes joint pain and deformity, as we can see in the image here. Because of this granulation tissue, RA can affect other systems as well, such as the lungs and the eyes. Like other autoimmune diseases, RA is characterized by periods of remission and exacerbations are often brought on by stress or trauma. A key feature of RA is going to be joint pain, and this is going to be worse on awakening because clients have been inactive during the night. A great way to distinguish RA from osteoarthritis, or OA, is that it has prolonged morning stiffness lasting more than 1 hour. OA is going to have morning stiffness that does not last nearly this long, and it's going to be relieved a lot more easily. Pain from RA improves with activity, but is not going to go away. RA also has symmetric joint involvement, and this usually involves the wrist and the proximal joints of the fingers. The joints are normally tender, swollen, and warm to the touch, just like in this image here. In our image, we can see red, swollen joints on the client's fingers. And RA is generally going to start at the wrist and the proximal joints of the fingers and work its way out to the more distal joints, as we can see in this image. Remember with autoimmune diseases that the body is essentially attacking itself, and so clients are going to have systemic symptoms as well. They're often very fatigued and have weight loss, and these clients are also anemic. Laboratory-wise, clients with RA are going to have an elevated erythrosedimentation rate, or ESR. This is going to indicate the presence of inflammation in the body. They're also going to have a positive rheumatoid factor. Remember from earlier when we said that autoantibodies are going to form within the synovial joints. These autoantibodies are known as rheumatoid factors. One of the most noticeable and debilitating complications of RA is going to be deformities of the affected joints. As granulation tissue starts to replace normal tissue, clients are going to have deformities. We can see here that clients often experience radial drift as well as ulnar deviation. One that you will see commonly is a swan neck deformity, and this is going to be in the joints of the fingers. Now, as I mentioned, these deformities are not just visual, they're going to be debilitating for clients, and they may have a hard time completing everyday tasks. It may be hard for them to hold a pen or pencil or hold a fork and knife. It may be hard for them to dress or bathe themselves. Another complication that's often seen are nodules, and as you can see in the image here, they often form around the elbows. Now, the nodules themselves are generally firm, fatty tissue that is not tender to the touch, but because of their location, they can cause a lot of pain and difficulty in movement. Now, you can probably imagine that when you factor in joint deformities as well as nodules and even systemic effects on the body, clients are going to have a lot of symptoms. So for symptoms, we can administer NSAIDs to decrease inflammation, as well as systemic glucocorticoids. Glucocorticoids like prednisone are going to relieve inflammation and symptoms, but because steroids have a lot of side effects, we don't want to use them long term. That's where our disease-modifying anti-rheumatic drugs, or DMARDs, come in, and these are immunosuppressants. Medications like methotrexate or biologic therapies such as TNF-alpha inhibitors are going to help prevent exacerbations for clients and reduce overall symptoms. RA often has a very early onset and can affect clients as young as 30 years old. Clients with RA often begin experiencing symptoms between 30 and 60 years of age. We want to make sure that clients are maintaining a sense of independence as long as they can, as well as maintaining their strength. So physical therapy and occupational therapy are going to be very important for clients with RA. In physical therapy, clients will learn how to safely strengthen their joints and their muscles, and in occupational therapy, they'll learn ways to complete everyday tasks that are a little easier on the body. Finally, when clients are experiencing acute episodes of inflammation, we can use splints to help prevent deformities. In addition to physical therapy and occupational therapy, lifestyle modifications are going to be very important for clients with RA. These lifestyle modifications can help prevent or reduce the number of exacerbations clients have. Clients should avoid repetitive movements that overuse affected joints. So think about something like knitting. It's going to be a very repetitive movement of the hands that can cause more inflammation and more pain. Clients should also distribute tasks to multiple joints or to strong joints. So if they're carrying something, rather than using one hand, they should use both. And rather than just using their fingers, they should use the whole hand. Which brings us to the next one of using our palms more than fingers for tasks. So think about when a client is standing up from a chair. Rather than pushing with their fingers, they should push primarily with their palms to keep the force off those affected joints. Range of motion exercises are going to decrease stiffness and increase blood flow. Improved blood flow to the area will overall decrease pain and decrease swelling. Clients with RA should also alternate hot and cold therapy. Heat therapy with something like a heating pad is going to help increase blood flow to the joints, whereas cold